Hey guys, back again with another video. So today we'll be talking about the New York State compounding exam. Woo! I think I'm gonna keep doing that. But anyways, the topics for this presentation is the purpose of this examination, the exam description and the components. We'll also focus on the content of the exam. And I'm also going to share with you guys on some tips on how to pass the exam and succeed. So the purpose of the exam, so the main purpose is to assess your competence in prescription compounding and pharmacy practice. And this includes all of these here. So sterile and non-sterile products. As you know, you're going to have to prepare a sterile product and a couple of non-sterile products such as, let's say, a solution, suspension, ointments, creams, capsules, actually. Performing dosing calculations. So for these preparations that you have to make, you also have to perform calculations for them. Medication safety plays a huge role because you have to make sure you label the product correctly. You have to make sure that the dosing is correct and all of that. Drug distribution also. So the exam description is here. So it's administered over 2 days. So first day, day one. So day one actually has three components. So the first component is the look alike, sound alike. And in my opinion, this is probably one of the easiest parts of the exam. So usually they say that you should not be getting less than one wrong. So it's 8 pairs, as you could see down here. So you have to get both medication indications correct in order to get the points. So it's very easy. They're gonna have a bunch of medications, a pair of medications. It's gonna be 8 medications, 8 pairs, I should say. And those 8 pairs, you're gonna have another box of indications on the right for you to basically write the number here for the indications. For example, like ass effects, you would select that the patient has GERD, or you're gonna put 51. Um, so the next component of day one is the patient profiles. So they will provide you with 3 different profiles, and this will usually include the patient's medication list and also like appropriate labs. And from my experience, they also included a prescription of for a new medication that the doctor wrote for the patient. Candidates are required to determine if an issue exists with its description. So basically, if you determine that there's something wrong with the prescription, based on the patient profile, then you have to include why. Like, what is the reason why you think that? You're also required to make a recommendation on how to rectify the issue and how to solve it. When I took mine, I had a patient who was on lisinopril, I believe, and the doctor wanted to switch the patient to Entresto, but the doctor stopped the medication, the lisinopril, when the patient went to see the doctor, and on that same day, the doctor wrote for a prescription for Entresto and told the patient to start taking it the same day. And that was wrong because you need to have a washout period of about 36 hours between an ACE inhibitor before starting Entresto. So it's like something like that. Um, the next one is the errors and omission. So errors and omissions portion also comes in day one. And this one, they give you 10 prescription scenarios, and I actually have an example on the next slide. So they give you 10 prescription scenarios, and each scenario will contain a prescription, the label that's required to be placed on the medication, and photo of the product chosen to fulfill the order. So basically, the doctor wrote the prescription. You want to check that that's correct. Then you want to check to see if the technician, let's say, grabbed the right medication. So you're going to have the label of that medication, like a picture of that medication that the tech grabbed. You're going to have that. And also the label. You have to make sure that the label on the product is correct. And if there's any issue you feel like, you have to indicate what the issue is. Like any issue that will prevent you from dispensing the medication. And if there's no issue, you can just say dispense as written. There's no issues. Okay, I guess the example is not on the next slide. That's interesting. Okay, I think it's gonna show up, but let's keep going. So day one, how to succeed. So with the look-alike, sound-alike, the only thing you can really do is just memorize, to be honest. But there is a list of confusing drug name from the Institute for Safe Medication Practice. So you could just search that. If you Google it, they're gonna give it to you, and you just have to get the indications because they give you the look-alike medications without the indications, and you need the indications as we saw earlier. So make sure you know the indications. That's like look-alike, sound-alike part is the easiest part of the exam. You should get all 8 pairs correct. Oh, here we go. Here's that picture I was talking about. So the errors in omission is gonna be something like this. So you're gonna have like a prescription here on the left, okay, and you're gonna have the label here, then the medication that the technician picked out. So you have to analyze all three to make sure that it's correct, and you will actually dispense it. So how to succeed on day one? So the patient profiles. So the patient profiles, you're basically an investigator. You have to look for everything. I know I listed a bunch of things here, but literally you have to look for everything from drug interaction, allergies, indications. I mean, from my experience, I think every profile they give you, there's gonna be something wrong with it. So just assume that it's something and just find it. Yeah, that's what I think. I don't think they'll give you something, but it's possible though. But just make sure you look thoroughly. So this is everything you check for: drug interactions, food drug interactions. Is a patient taking herbal supplements? Or did they like start drinking this new medication? Or like started drinking this new weight loss product? All of that. Allergies. Like you have to know if a patient has like sulfur allergy, what medications can they take or not. The indication, you know. Does the patient's disease state on the profile match the indication of the medication? Patient issues. Maybe the doctor thinks the patient is not compliant and raise the medication dose, or maybe the doctor thinks the patient is compliant and he increased the dose, not knowing that the patient just hasn't been picking up the medication. Something like that. Food drug interactions, like I talked about already. Formulation of the medication, that plays a huge role. Organ function, therapy, duplication, maximum daily dose, so many more. This is a few others. Cumulative adverse reactions. So if the patient is on multiple anticholinergics and is an elderly patient, you probably want to be careful. Review medications to avoid if you have a sulfur or penicillin allergy. This is extremely, extremely important. And I should have included sulfone. So sulfur, sulfone, and penicillin, the most common ones. Or even an egg allergy, right? You have to know that. Age of the patient. So tetracyclines and fluoroquinolones cannot be used in children. So you want to look out for that. There's other examples also. Did you notice how the patient profiles came late? Anyways, um, the gender of the patient, right? So like Accutane, for example, and ACE inhibitors in pregnant women. So you want to be careful. Look out for that also. Specific time of the day the medication is administered. We usually give statins at night, but there's some of them that you could give during the day. For example, atorvastatin and rosuvastatin, actually. Timing with meals. Some food can enhance the absorption of certain meals, so it's recommended not to be given together. So you have to take that into consideration also because that could lead to toxicity, possibly. I don't know why that thing keep coming last. How to succeed on day one for the errors and omission part. So this part you want to focus on like the legal requirements for the prescription and labeling. That's like the main thing. So let's say the medication is C2. There's very important things that should be on the prescription and the label that may not be required for a regular medication that is not controlled. So look out for that. Scope of practice of the prescriber. I remember when I took mine, I had a midwife prescribe a tetanus vaccine for pregnant women. Is that okay? Of course, because that's a midwife's scope of practice, and they had to have like a certain indication on their license number in order to actually prescribe that. So that's very important. So you have, for example, like an infectious disease doctor prescribing opioids constantly. Is that okay? Maybe not, because that's not your scope of practice necessarily. Generic substitution requirement. So if they write a prescription and they don't put DAW in the box, that means you could substitute. So that's very important also. Medication indication, dosing, and instructions also. Day two, compounding. This is the day that everybody is afraid of. Why? Because you actually have people watching you, okay? So you're going to be asked to make three products, one sterile IV solution, and then you have two non-steriles. It could be suspension capsules, which I didn't include, solution, ointment, cream, suppository, etc. Each preparation accounts for 20%. So you're gonna have a calculations portion where you answer questions. 7% for your final product that you make, and 3% for the label. And when you're making a sterile compounding, your technique is crucial because there's gonna be somebody standing right next to you, just looking deep into your eye, just waiting for you to fail, so that they could just give you a zero. So that's what scares people the most. I guess fortunately for the non-steroids, usually one proctor looking over more candidates, so you won't be that nervous compared to the sterile compounding. You must label products after preparation. That's very important. You have to label it correctly and make sure the label is correct. The information on the label must be correct. Day two compounding, you must remember this. You can make fatal errors in day two, and you could actually lose everything, literally everything. Okay, so I'm going to share with you on certain things to look out for and to make you succeed on this day. Okay, practice making sterile products in school, rotation sites, work, home, etc. And I said sterile products, but of course non-sterile also. But sterile is the main one simply because, like I said, somebody's standing right next to you watching you. Okay, so that's why it's very important to master this one. So from my experience, I was an intern, so I got a lot of practice where I worked. But let's say you work in retail and you don't get a lot of practice with sterile products. When you go on rotations, let's say to a hospital, some of them will allow you to practice, so you just have to take the initiative to ask. Some may even give you like very small normal saline bags, with some syringes And you could go home and practice also. So you just have to ask, really. Practice the calculations multiple times, literally. Like if you could do it over and 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 over, you get the point. Over again, you're gonna be comfortable. And I say this because you can make a fatal error. Okay, so just make sure you're extremely comfortable with the calculations because they could trick you. They could definitely trick you on that part. And develop a habit of double checking your work. If you're somebody who doesn't like doing that, well, you better get in a habit when it comes to day two, because you definitely don't want to make a fatal error. So that's the end of this video. If you have any questions, drop it in the comments or message me. I will answer as soon as possible. Thank you all for watching this video. And just know that I will be making a series of lectures that focuses on the calculations of day two compounding. So I'm gonna have I guess like a playlist for the IV medications, right? The sterile compounding calculations. And I'll have one for like ointments, creams, capsules, suspensions, so that you guys can really get comfortable with it. Okay, so until then, see you.